Do we have any questions from the floor from our three industry representatives? Yes, over there.
So there has been a lot of public cooperation and a spirit of sharing and so forth in this pre-competitive stage heretofore. But we talked about developing biomarkers for use, and then that brings up all kinds of intellectual property issues. So initiatives are very forthcoming about depositing all their data to be shared in the repositories, and then bioinformaticians can come later and then start mining those for biomarkers. And the bioinformaticians might be publicly funded or privately funded, and then the industry can then come later and start profiting off of those. So it seems like unless this is carefully planned for, in the future there could be potential for conflicts to arise.
This is absolutely correct, and it's one of the points which have to be solved very early in the discussion in a given consortium. But there are maybe two points to answer. One is that in the future, the intellectual property of biomarkers will stand not only on the individual marker, but on combination of markers. And a lot of intellectual property will be derived from the way you organize multi-marker analysis. And this can be specific for a company, even though the individual data are publicly listed. So that's one point, but it's complicated, but it is feasible. And the second point is that a company can also plug into a consortium by providing the clinical evidence for some specific studies or some specific tools. So it's absolutely true that this has to be solved. There are other examples in medicine and public health and other technology where this has been addressed, and it is feasible, but it has to be addressed early in the development of a consortium.
I would just like to add the fact that the same applied to drugs long time ago, and that today, since the biomarkers are developed, and Christian and myself did show it, are developed by doing very costful developments. It's something which is more and more taken into account by the IP people, that they need to think with us on the way to protect the new biomarkers. Maybe not only the metagenomic signatures, but add a layer of protection with the clinical development, add a layer of protection on the fact that there is some utility which is demonstrated.
Okay, Disco and then that gentleman over there.
Notwithstanding the difficulty that one may have in handling the issues that Ruchira raised, I think it is, from the point of view I have, important to attract industry to this field. And the question would be, what advice could you give us collectively, how to reach out to other places than you, whom we succeeded to convince? You know, I was kind of struck and astonished by the fact that this conference, which many of us find quite interesting and imaginative, didn't attract that many nutritionists, as you pointed out, not so many gastroenterologists. We seem to have already a difficulty of interfacing with the medical community, and perhaps even more with industry. So what kind of advice would you give, knowing that I think Christian did refer to, you know, how difficult is it to steer a big boat, to make a big boat change its way. So, what kind of advice would you give to us collectively?
Well, first, by joking, I would tell you that I don't want you to attract our competitors. So
somehow
I will make no effort to answer this question. Now, more seriously, there is no specific. I believe that from an industrial partner, you need to see the quality of science and the quality of evidence. And this is what you are getting. I mean, really, I mean, you see, you need to really convince that it's not only fantastic science, it's really solid science, it's growing science, and it comes to clinical. And this is exactly what you are doing. So then the second point is really the market analysis by large companies. Are they convinced that this is a very important market and that they have to enter this? There is no miracle. I believe it's, you need to promote. There are many, in fact, places where you can contact many industrial partners together, you see, in some bio or other. And you have to be there. I'm sorry, it's a little bit simplistic, my answer. But again, it's really, you have to promote again and again that, one, the quality of science, second, the market, and the translation which is being really occurred. That it's not only something very far upstream, it's something which is really coming. So it's easy to tell, but that's really the answer. And then you need to find the appropriate tools regarding communication, and you have tools which are well identified, and that's my, I don't know if you have other.
Well, my comment would be that I think probably it also depends on the industry segment that you're targeting. And I have the feeling that the segment that I represent, the food industry, is much more aware and active on this than maybe other areas like pharma industry.
Okay, one more question over there.
I guess you're a bit pessimistic, Duško, because if you count on the 600 people attending this meeting, there is something like 25% coming from the industry. Of course, it's a huge number, according to the early stage of development of this new science. But I would say that most of the people attending the meeting and coming from the pharma industry are coming from the R&D side, which is a good sign. It will take some time for them to be aware of what's going on. And then on the second part of your comment on the clinicians, I would say that our experience is that we are meeting very enthusiastic clinicians that are attracted in the metabolic field, in the liver field, by the microbiota science, definitely.
So you're telling me that I'm too impatient. Yeah.
Can we actually get a quick show of hands? How many clinicians are in the audience now? That is a small smattering. Okay. Right, one more question over there.
So I think it's time for this field to really speak more loudly globally, and this is where I think the international partnership is going to be very important, to let the public know that we are really on their side, and that is to promote health, prevent disease. And to get more specific, I'm going to just mention nutrition and antibiotics because I think there's a lot we can do in two ways. One is funding new projects that are collaborative that will generate the data so that we have evidence-based medicine. And we can promote dietary guidelines that are based on information. And I think funding projects in which one really compares the possible issues with, let's say, certain diets, high fat. We're seeing a lot of data already, but I think we need to take the projects, extend them, and also let the public know what are the risks of a high-fat diet, and maybe through YouTube and through the internet, work in ways of publicizing this through videos that are educational. And secondly, antibiotics. I think it's becoming quite clear in following Marty Blazer's leadership with the disappearing microbiota hypothesis presented again at this meeting, that we also are going to need to become more vocal as a community about the harm that medicine physicians are doing in the pharmaceutical industry in promoting rampant antibiotic use globally. I understand this is a difficult thing because there are a lot of jobs and a lot of money at stake. But again, it's telling the globe that we really are out to improve human health and not to protect market position. And I think it's time that we really try to think hard about how we fund projects that look at antibiotic utilization in a more comprehensive way and the impact on these microbial communities in the gut and other body surfaces and how that may be deleterious to human health. I know in our own hospital we see so much rampant antibiotic use in pediatrics, as Marty pointed out today, neonatology, especially early in life. We may be having, well, I'm sure we're having a detrimental impact on many children that simply don't have a voice in this. So.
Okay, would any of the panel like to speak on the issue of talking more loudly to the public about about what we can do in this field? Or any of our other panelists? Okay, we'll get back to that later. There'll be we're going to hear about public communication in a future talk. Any further questions? Yes.
So I know everyone has their pet population or pet disease or pet condition that they think is important, and I would just like to speak up for the study of pregnant women. I think we've heard a lot at this meeting about implications for health, and I think without studying the microbiome in a prospective fashion in pregnant women and with their offspring, we're going to be not only ignoring a lot of the biology, but we're going to be ignoring the potential public health implications. And we're not going to be able to extrapolate any findings we have from non-pregnant cohorts to pregnant cohorts. They deserve special attention and special study. About 25% of the world's population is pregnant at any given time. And so I think that it's really important not only for this science, but also for public health initiatives. And I know many times agencies and industry shy away from studying pregnant women. It's a little bit scary for people, but I would encourage you to really reach out to the community of us that do research and practice clinical medicine in this cohort, because there's a lot of good things to learn in it.
Does anyone have any responses about the issue of reaching pregnant women? Does anyone else have one final question? Aha, Julian.
I just have a comment with respect to this development by industry. I'm hearing this like the beginning days of the biotechnology industry. And the point is that if you have something, either if you're a company or a university, if you find something interesting in your lab, patent it. I mean, that's the only way this is going to develop. And so that the researchers have to take the initiative here, and the industry people involved as well. But if you don't patent anything, you're not interested, you're not moving. That's all I have to say.
Well, this is very wise.
Patent it and call us.
Okay, excellent.